We're going to take you live now to Olivia Chow's campaign office, where the Toronto mayoral candidate is making a campaign announcement. We'll listen in live.
Police. Peter doesn't need any introduction. Everybody knows Deputy Chief Peter Yuen. I'm here to talk about safety, and I want to start by telling you a little bit of what I experienced. When I was a teenager, my dad have mental health issues, and occasionally he gets violent towards my mom, never to me. And as a teenager, I didn't know who to call. I wasn't sure I should call 911 or what should I do? I have no idea. I also took karate and judo when I was a kid, so I grew up to be quite strong, and I was able to protect my mom. But had it escalated to something very serious, I don't know what I would have done. Fast forward many years later, my dad now is in his 90s, living in a nursing home, long-term care home. And he got pneumonia, and he couldn't breathe. The home's people called 911 and was put on hold. And I called 911, desperate, and I was put on hold. And perhaps because I was pushy, aggressive, I don't know, I was able to get them to come. I'm sure they would come anyway, but the wait seems like it was eternal. It was so long. It probably was just a couple of minutes. I don't even know. I was just panicking. When we need help, we need to be able to rely on public service. We need to know who to call. We need to know the City Hall has our back. And that when we do call, that we don't have to wait too long, that immediately help is on the way. We deserve it. But sometimes that is not the case now. Why isn't it the case? I'm going to explore that. One thing that I would do first is I will expand the community crisis service. This community crisis team sent out mental health experts to the crisis health calls. So someone that is, if you see someone on the street that are acting out that obviously is not really having, it was really in the crisis mode, they are waving their arms or they're walking out in the street, they're not in control, who do you call? And one of the things we want to do is encourage people to call the Toronto Community Crisis Service. This service has been piloted at 60% of the city. It works well and has been hugely successful. And what we need is to expand it across the city 24/7, so that this service is available to all those people that needs it, those that are in mental health crisis. Right now, there are 3 teams that are dealing with crisis. One is the Mobile Crisis Intervention Team. It's organized by the police. Peter Yan would know a lot about it. It has a mental health support nurse attached to it. Team number 2 is that at the 911 call service, Gerstein Center, which is an expert in dealing with people in mental health crisis, is co-located there. So they're able to divert some of the calls. They're able to deal with the person that are in crisis or their neighbor immediately on the phone. But that funding is finishing in October. The third piece is, of course, what I just talked about, the Toronto Community Crisis Service via the 211 call. What we need is to bring them together, streamline them, coordinate it, and that is what I would do, a transformational team that would make sure that the work are done well, so that the public would know that if you call, you're going to get the right kind of expert at the right time for you. So that is, it's called the Emergency Response Transformation Team. Also, this team will do a coordination of a big education campaign, because right now 60% of all the calls to 911 are not emergency call. These calls clogs up the lines and cause people to be stuck waiting for help. With a strong public education campaign, we can shorten the wait times. And of course, there are other things we can do also. That is, in fact, part of the Auditor General report that came out last year. So let's fix the long wait time so people can get the emergency support they need when they need it.